missiles in less than 5 minutes. Soldiers march inside my mouth, slide down my throat, crawl inside my womb, and leave a hand grenade. So I will feel this war as a birth. But of what? Of blood, of children's bones, of decapitations, of hate, of geography. Occupation always produces violence. But I'm asked to speak of peace. How can I, with bombs exploding, killing the unborn and their siblings? Why is genocide acceptable to some people and not to others? Holocaust versus Holocaust versus Holocaust. The ones they celebrate, the ones they never mention. I feel as if I'm burnt to ash, my shoes being thrown into a pile of other shoes, my ancestors ripped from their homeland and sold like cattle, the place where God is on the money. Are they going to save me now? Where is America? In a series of long meetings, mourning the loss of the family cat, there is no place for politics in the face of genocide. But genocide is political, religious. How much money to clean the blood off the streets of DC and Texas, Ohio, Baltimore? We already dead, they think. Still, we fight without armor. Our children's dead flesh become our skin. We wear the mask, attempt smiles. I don't jump as much. When I hear them coming, falling right on my block, I just hold onto an object and shake inside and wait for it to be over. But it is never over. It is freezing cold. I dream of summer. I dream of warm food and a hot shower. I dream of freedom. In Chicago, in Detroit, in Harlem, in Brooklyn, in Soweto, in Compton, in Oakland, in Kansas, in Cuba, in Gaza, in apartheid, in South Africa, in Alabama, in our education system, in our subconscious, in Dearborn, in Mississippi, in our judicial system, in our prisons, in our policies, in our death chambers, in our mind, in apartheid in Gaza, our mosques, our homes destroyed in Gaza. Some of our own sit in silence in Gaza. There is no electricity in Palestine. There is no water. Where there is no water, there is no life. I scrape the blackness of this night sky on fire and wrap it around myself for shelter. Tomorrow, I'll find a cloud for my head and I will summon a light rain to shower. God is close. God is coming between our breath. Before another bomb calls our name, we will answer back. We will sit in the room. If we die, we die together. No one will be left behind. This is the bravery of God's people. We will not cower. We will not cower beneath the rubble of a Rafah refugee camp. We will scream. We will pray injustice in the other direction. We will find peace in death, if not in life. I mean, thank you for having me.
Jessica, you're amazing. Thank you so much.
Thank you for having me. I love you. Thank you.
I love you. So next, we're going to hear from State Representative Abdel Nasser Rashid, who was there in the West Bank this past summer, who wants to share with you all, as a Palestinian American, the direct impact he saw in his own state. 6-year-old Wadiya, mutilated, stabbed 26 times because of the unbelievable dehumanizing and hate rhetoric and the genocidal language that is coming out of the administration and out of those that continue to push for this violence. With that, Representative Rashid, please, thank you so much for being with us, and thank you for sharing.
Thank you, Congresswoman, and thank you for organizing this important conversation. As we all work toward a ceasefire, de-escalation, and peace, it's also important that we do everything that we can to protect our communities right here in the United States. And unfortunately, the dehumanizing language and rhetoric that has been allowed by our media and by many elected officials, the dehumanizing of Palestinians has bled over into, we saw horrifically, into Plainfield, Illinois, where 6-year-old Wadi' al-Fayoumi was stabbed 26 times with a military-style knife that was retrieved from his abdomen during the autopsy. And while some people are saying hate has no home here and decrying this violence, we have to understand that it is the dehumanizing of Palestinians that has been allowed over the last few weeks and decades that has now enabled those who have hate in their heart here to attack Palestinians, to attack Muslims, and to attack anyone who is fighting for justice. I want to, share. I stepped away from an event for Care Chicago to jump on this call, and I heard that just last night, Kara got a call at 9 p.m. from somebody that was attacked with a knife last night. So this is continuing, and we have to do everything in our power to protect ourselves and to protect our communities. And we have folks here from across the country. Please make sure that you're in touch with the proper authorities to protect your families, to protect your children in schools, and do not hesitate to speak up and to make sure that your right to be protected is being responded to by government agencies and also by nonprofit organizations and civil rights institutions. It is absolutely critical that we not be silent in the face of hate and harassment and hate crimes. Reach out to your elected officials, reach out to your law enforcement officials, and anyone who is in a position to make sure that you're protected. And that needs to be done alongside our continued fight to stop the genocide in Gaza, to call for a ceasefire, and to finally forge a pathway that actually protects Palestinians and Israelis alike. Thank you.
Thank you. Mayor Abdullah Hammoud.
Thank you so much, Congresswoman, and thank you to all for being here. I had the distinct privilege and honor of serving as the mayor of Dearborn, Michigan, a city that shares the longest border of the city of Detroit, most notably known as the hometown of Ford Motor Company, but also as the capital of Arab America throughout these United States. We have our home to the highest concentration of Arab Americans in North America. This is a city of refugees and immigrants from across the globe, including myself, a son of two immigrant parents who came over from Lebanon. And we are a city that carries the scars of war in our memories and on our bodies. Countless community members who know the horrors of the Israeli military brutality firsthand, and now they're watching that brutality unfold. And it brings back many a trauma that never left. And when I think of what's happening overseas and when we watch it unfold through our screens, I think of individuals like Abu Dawood Kazzaz, who immigrated here from Sheikh Jarrah and is currently a Dearborn resident. Sheikh Jarrah is a neighborhood in East Jerusalem. And we know what's happening there, where individuals are being pushed out of their ancestral lands in a form of ethnic cleansing. And the Kazzaz family are actually serve as generations as those who were the caretakers responsible for the Al-Aqsa Mosque. This is the history that we have within our city. When I think of the brutality of the Israeli military, I think of the Turfi family, who had to dig their grandmother out of the rubble from under the building that was struck by an Israeli airstrike in South Lebanon, who currently reside here in the city of Dearborn. I think of the Debeza family and countless others who still have the paperwork saved at home, in which IDF soldiers had to stamp, granting them the approval to move within the village that they were born in. This is the brutality that we know is the Israeli military. And what we cannot bear any longer is that we hear nothing but utter silence and erasure of our voices. We have radio silence from all those whom we've elected, who promised to be a big tent and wanted to carry our values and our principles and the policies that we care for. But thus far, to this point in time, have not had the courage to stand forward and call for a ceasefire and actually work towards a just solution for the Palestinian people. We have family members who are currently trapped in Gaza who have been ignored. And the calls for ceasefire have been drowned out by nothing more than the drums of war and racist media coverage that dismisses the massacre of entire Palestinian families as collateral damage. To date, 75%, nearly 75% of all those who have been murdered in Gaza and throughout the occupied territories and the West Bank, but in particular in Gaza, have been children, elderly, and women. It's time for us to find our spines. It's time for us to step up and step forward and demand a ceasefire from all the electeds across this nation.
Thank you so much, Mayor. Now we're going to hear from folks that have been on the ground, that have worked with humanitarian organizations and hospitals and those that provide medical services to Gaza residents. Nurse Kathy Woodward is a nurse practitioner with over 20 years of experience. She has 10 years of experience just alone on medical missions to Gaza and then the West Bank with the Palestine Children's Relief Fund. She was most recently in Gaza this past August of this year, providing education and conducting needs assessments in several of the neonatal intensive care units. We're going to hear from Nurse Woodward.
Thank you for having me on today. I thought it was important to tell you not only about the babies in Gaza and what's happening to them, but also their caregivers, who we've remained in contact with as best we can over the last several weeks. Just to give you an idea, the World Health Organization says about 183 babies are born in Gaza every day. And to make that something that you can put in your own neighborhood, Wayne County, I think, has about 1.8 million people. There's about 2 million people or so in Gaza. And the birth rate for Wayne County is 72 births a day. And so Gaza has about 183. If you do the math, then about 12 to 15 of those babies will be prematurely born and need some extra care, maybe a lot of extra care, maybe some place where they can stay warm and be fed for a couple of days while they adjust. And that's what's not happening in Gaza these days. Two of the neonatal doctors or the pediatricians taking care of these babies, one of them, Dr. Said, wrote us about a day before the blackout that she was working in Al-Aqsa hospital, which is about a 12-bed neonatal unit. It's not a place, it's a place that sends sicker kids out. They don't keep the really premature babies. They don't keep the really sick babies. They send those babies out to a large hospital in northern Gaza, which has been closed. That unit, they have no more room. They cannot take any more babies. And so nobody's being transferred out anymore. The things that she has been telling us is access is a problem for her getting to the hospital. They don't know if they're going to have it tomorrow when they leave their homes to come to work. The access for the mothers, they can't get to the hospital. And the babies that are born, that may be born at home that need some care, they can't get them to the hospital. She's finding that women are going into labor early, and they're seeing a lot more premature births, most likely due to the stress of the war. They lack everything. They've never had much. And even on a good day, they worked in the most dire of circumstances. But now they don't have enough for the children they have. They don't have enough fuel to know whether or not they're going to be able to run the electricity in their units for the next day. And those electricity keeps the incubators warm, and it keeps the pumps that are feeding the babies on, and it keeps the energy on, the lights on, so they can see what they're doing. And so electricity in a neonatal unit is absolutely needed. There is no work in a NICU that can go on without electricity. One of the things that was the saddest thing she said they didn't have is safe water to wash their hands. So I think about, as a nurse practitioner, I wash my hands thousands of times a day, and they have no fresh water and no safe water to wash their hands. And so there is no hand hygiene between patients, and they don't have gloves. And so those really sick babies who need to be protected are not getting the protection they need. Another physician in southern Gaza, which is where everybody's supposed to be moving to southern Gaza, and you've heard this on the news, Rafah, the hospital is Emirati hospital in Rafah. It's closest to the Egyptian border. They have a 9-bed NICU. That doctor and the nurses in that facility are so impressive. They're great people. They want to provide the best possible care for those babies, and they do everything possible. Anytime a course is offered, they're at it. They just want the best for these kids. And what they're finding, because they're a very small hospital and a very small unit, all their babies go out. If it's a sick baby, they transfer them north. Well, that's not possible anymore. So they have a 9-bed unit, and they're putting 2 and 3 babies in each isolette. And they only have 3 ventilators. And so if a baby comes in that needs a ventilator, they don't have one for that baby. And so babies are dying just because they can't get transferred to the units that they need to be. They don't have access to the ambulances. They can't get their babies anywhere they need. And so that lack of equipment, that lack of ability to do the care that they know they could do is just horrifying for them and traumatizing for them, in addition to the trauma that the babies are experiencing and their families. And so if anything we learned today, I hope that all of us can come together to save these kids and their grown-ups that are living under this occupation and ceasefire now. Thank you.
Thank you so much. Next is Dr. Zina Salman. She's a US-based pediatrician specializing in oncology and childhood cancer care. She has worked at Johns Hopkins focusing on international and refugee health. Some of the incredible work she's done, among most notable achievements recently, is that she worked on the Safer Ukraine initiative to evacuate children with cancer from Ukraine last year. And now she also serves as a main medical advisor in the building of the only pediatric cancer department in the Gaza Strip. She's been living and working in Palestine on and off since 2014, supporting childhood cancer needs, and was in Gaza just about a year ago. Dr. Salman.
Thank you so much, Congresswoman Rashida, and thank you for organizing this important event tonight. Thank you for having me as part of it. It's my honor to bear witness and to do my best to amplify the voices of Palestinian children that I've had the honor of meeting over the last almost decade that I've been working on and off in Palestine, and particularly in Gaza. My name is Dr. Zina Salman. I'm a pediatric oncologist. That means that I take care of children with cancer. And I've been going to the Gaza Strip since 2014 was the first time that I went there. And tonight, I hope to just share with you for the next few minutes about some of the things that I've seen over the years, the terrible living conditions that children have to live in the Gaza Strip prior to this horrific war, and how much worse the situation looks right now. As Rashida mentioned, I've been going there for almost 10 years now. And since the first time that I've been there and the many times over the years that I've been going there, I've only seen the situation worsen. As many of you probably know, the Gaza Strip has been blockaded for almost 2 decades now. So what does that mean? It means that there are artificial borders created all around the Gaza Strip, and the people living in there, 2.2 million people living in 140 square miles of space, about the equivalent of Philadelphia. That's about the population density of a city like, or a place like Hong Kong. These people are living on top of each other almost, with minimal access to the outside world, minimal access to resources. Kathy mentioned some of this. I've seen that when you turn on a tap, you get salt water. There's almost no access to fresh water unless you purchase it to be able to drink it. There's only 3 to 4 hours of electricity off of a power grid. And so the majority of people live without electricity for the majority of their day. Hospitals have to work off of generators. And this was the case even prior to the war, is that hospitals were depending on about 4 hours of electricity off the grid and needed generators and fuel and all these issues that we're hearing about these days with fuel shortages and what that means for patients, which I'm going to get to in just a moment. But what that means for everyday civilians, Palestinians living in the Gaza Strip, is that they go home and they study by candlelight. It means that they can only buy a little bit of food at a time because they don't have the ability to refrigerate their food in their homes. Things that we don't necessarily think about as indirect consequences of the sort of lives that they lead under a blockade, particularly for children with cancer. So when I first went to the cancer department, and we built a cancer department through the Palestine Children's Relief Fund in 2019, but prior to the building of that department, we went and saw in the Rantisi Hospital in Gaza City what the conditions were for children with cancer at that point. And we saw a very small unit in which there were 5 or 6 children with their families within a single room, and having just 3 or 4 of these rooms, walls that were crumbling, no access to chemotherapy, no access to surgery, no access to all the different complicated medications and things that different treatments that children need to be able to survive cancer. And an important thing I think to note is that childhood cancer is highly curable. It's very different from adult cancers. It's certainly a horrific thing to have to live with, but it's highly curable. In the West, in high-income countries where only about 20% of children reside, over 80% of children can be cured and live reasonably healthy lives after a cancer diagnosis. In low-resource countries, and that's even without the idea of a blockade, where, low resource countries where 80% of children reside, they have less than 20% survival rates. And then the situation is only more complicated in the Gaza Strip, where children are blockaded. When a child in Gaza is diagnosed with cancer or suspected to have cancer, Here is what they have to go through. I'd like to paint a picture for you all tonight so you can understand the normal day-to-day lives of sick children in the Gaza Strip, again, before the war, which I will describe for you in just a moment. Prior to the war, when a child is suspected to have cancer, they went to that cancer department, or the one that we've built since then in 2019, that's been open for the last 4 years. And the basic diagnostics that they would need to confirm that cancer is the diagnosis were not available. The reason they weren't available, even if a machine was purchased, donated by an NGO or by a government, which has taken place in the past, oftentimes we have people who need to train on those machines. They apply for an exit permit to even be able to leave and train to be able to diagnose cancer, and they don't get those permits. So we don't have trained healthcare workers who can even do the set types of work that would enable us to be able to say that, yes, your child has leukemia, or your child has sarcoma, or your child has this type of tumor, a brain tumor, for example. So what happens then? The doctor says, we think you have cancer. We cannot confirm in the Gaza Strip that you have cancer. Here is a medical record. Take this to an office where you're going to apply for an exit permit to leave. You need multiple documents to be able to apply for this, and it's going to take time. And you need to determine a medical companion who can travel with this young child, a 4-year-old, a 6-year-old, who needs to travel out of the Gaza Strip. That medical companion, a mother or father, is going to go and apply for a permit. And the majority of the time, those parents' permits are going to be denied because there is a rule that in order to obtain a permit from the Israeli army, you have to be over the age of 55, and no parents of young children in Gaza are over the age of 55. So what does that mean? A grandparent who's often ailing needs to go and apply for a permit to leave too. So now you have round 2 of applying for a permit, and you have additional delays for this child with cancer for whom time is of the essence. So now you have a grandparent of the neighbor, you have the great aunt, you have somebody who's never met this child before applying for the permit along with the child. The child needs to the doctor needs to request an outside appointment. They have to fax those records over or scan them over, get an appointment outside. That takes more time. They then need to request financial coverage for the Ministry of Health to be able to cover the cost of their care. They need to find finances to be able to cover the cost of travel to be able to leave the Gaza Strip. By the time all of these things have taken place, we are talking about sometimes weeks and weeks and weeks. In the US, if a child is diagnosed with cancer, they're diagnosed in a day, and that same day they have started treatment, maybe next day max. We are talking about weeks just to be able to get basic documentation and permissions for a child to be able to leave, just so they can leave with possibly a stranger to go start the terrible course of chemotherapy, surgeries, procedures, etc., outside of the Gaza Strip and be separated from their family. Once they've obtained all of this, then they would have to go through a military checkpoint where they would be searched, have their items poured out of their bags to be able to cross over multiple checkpoints and do the hours-long trek to be able to go to Jerusalem, to be able to go to a West Bank city or another hospital somewhere else to be able to start treatment, at which point a child is then admitted to a hospital, again, with a distant relative or someone they've never met before, undergoing the horrific treatments that are required for cancer, chemotherapy, making them vomit, making their hair fall out, getting procedures, having needles placed in them, IVs, et cetera, et cetera. I mean, you can just imagine how difficult it is for a child here in the US to get that kind of care, and then just multiply that exponentially to envision what takes place. And the child completes that first part of their chemo or the first part of their treatment or surgery or whatever it is they need, and they eventually make that trek back home. And they have to do this again and again and again, because some types of cancer will require even a couple of years of treatment. And so you're talking about multiple delays, multiple trips out, family separation, psychological trauma that entails. And the list goes on and on, just for a child to maybe have a chance at cure, which, it's a much lower chance of cure when you think about all of the delays that take place. This is what happens on a normal day when Gaza is not undergoing, ceaseless bombing, relentless airstrikes and missiles. So what's happening today? Since October 7th, the situation, I couldn't have imagined a worse situation for our children with cancer in the Gaza Strip. And since October 7th, it has been each day waking up to an unbelievably worse situation and worsening with each passing day. Each day I call the department, I call the physicians and the nurses and the families and the social workers and the many people that I work with. The first thing I do when I wake up in the morning in my warm bed in the safety of my home is reach out to people by WhatsApp and try to just ensure first and foremost that people are safe and alive. Now, as you may probably, as you likely know, the Israelis told northern Gaza, warned them to evacuate to the south. And this is virtually impossible for someone to evacuate from a hospital where they're admitted inpatient for treatment. They asked all these hospitals to evacuate to the south, and the hospital administration said this is impossible. So we have children and their families staying in the hospitals, sheltering in the hospitals. A hospital is not a shelter. And the reason, as we've all seen in the horrific news recently, is that hospitals are not safe. They're not safer than anywhere else. Any place can be a target right now. So we have children and their families who are getting treatment for cancer in a hospital where the walls are shaking. The last 36 hours, I've received messages, videos, and photos of the ceiling coming down onto our children with cancer, falling on their heads. In the meantime, some of the healthcare workers have been able to evacuate, and rightfully so. They're seeking their own safety and shelter for themselves and their families. And what that means for our children is now the treatment that they were seeking, they're not even able to get. So now we have what's reported to me is that we have hundreds of people sheltering in the hospital, getting intermittent treatment, minimal access to drugs, running out of medications, no ability to get procedures, no ability to get referrals for any of the care that they need. There are shortages of food. As Kathy mentioned, there are shortages of water. Today, I was called this morning begging me to find a way to intervene to provide water to the children in the department. I'm being told children are giving medication, and they said, I can't swallow this pill because we literally don't have a drop of drinking water. These children whose biggest fear, their family's biggest fear, was cancer before, and then bombing, and now it's starving or dying of dehydration while sheltering in a hospital. I just cannot imagine more cruelty or more torture for these children who've already suffered so much. I hope that I've painted for you a picture of what's going on in the Gaza Strip today and some of the many, many reasons that we need to demand a ceasefire now to save the lives of these disenfranchised children in Gaza. Thank you all so much.
Thank you so much, Dr. Salman. Next, we're going to bring a voice that has direct contact in Gaza and has been at the forefront from day one. Yahya al-Arashi and his father, who has been trapped there with his wife Layla for 2 weeks, has been living a nightmare. And now his father has no access to medication. And I want you all to hear from him directly. He talks to his father as much as he can every single day. And, you know, he's very much devastated and heartbroken that his own country, the United States of America, is not doing everything possible to save his father's life.
Yes. My name is Yahya al-Arashi, and I'm a Palestinian American. My family is in Gaza. My parents, who are American citizens, are trapped in Gaza and abandoned in Gaza. They have basically limited to everything, limited to water, limited to food, limited to medication. And my dad literally has diabetes, so does my mom, and high blood pressure as well. And they have no medication. They were supposed to be back to the States on October 20th. And due to this situation right now, they're not able to leave. And they're literally hearing strikes every single minute. My dad was actually telling me that he's probably not going to come back. I mean, he's going to die any minute, so many times. And I told him to just believe in God, and hopefully he'll be back soon. I try to give him a lot of warm messages so he can feel that he will be back here with us. And there is no peace. There is no peace of mind. There is no safe place over there. That's about it. And he's actually staying in the hospital as well. Yes. Yep.
Yeah, thank you, Yahya. I know all of you who may follow me, I've been sharing Zakaria's story. He has gone a number of times to the border. It's not been open to for him and his wife, Yahya's mom, for them to pass over, and it's been incredibly scary. Every day we talk to him, we feel like he's deteriorating not only physically, but really emotionally and mentally. It's been a strain on the whole family. And thank you, Yahya, for being here and sharing.
You're welcome.
Next, we're going to have Ahmed Abu Znaid, who is with the U.S. Campaign for Palestinian Rights. It's important as folks, as we begin to, in this call, that you all please lift your hands, raise your voices for action. Please help do what you can for our country again to begin moving towards facilitating a ceasefire and ending this unbelievable, unimaginable violence on the Gaza people. With that, Ahmed.
Thank you, Congresswoman Tlaib, for organizing this space and bringing so many of us together for a just and righteous cause. As was mentioned, my name is Ahmed Abu Znaid, and I represent the U.S. Campaign for Palestinian Rights. I'm a Palestinian born in Jerusalem, and my family's from El Khalil and Dura El Khalil, and I've lived in all of the above as a child. So the U.S. Campaign for Palestinian Rights is a network of organizations across the U.S. committed to ending all U.S. support for the apartheid state of Israel. We believe that our tax dollars should be dedicated to funding healthcare, schools, infrastructure, and more, rather than subsidizing the Israeli genocide of the Palestinian people. So I'll take a couple of minutes and I'll leave you with some next steps. If you visit uscpr.org and click on Take Action, there are tools that will allow for you to email your members of Congress and call your members of Congress. In addition to that, at uscpr.org, you'll also find an updated list for all the protests across the US that you can join. And this is important. If you want to join us in DC November 4th, we'd love to have you, but there's actions all over the country. Okay, another tool that I want to let you know of at uscpr.org is our military funding map. This map can help you identify how much your county, your state, or your city is actually siphoning off federal tax dollars. Instead of these necessary items like healthcare and schools, they're going to funding, again, Israeli apartheid. I want to also let you know that U.S. Campaign this week has a week of action for Palestine. You can get involved in district beginning tomorrow through Saturday with in-district local demonstrations to pressure your members of Congress to call for a ceasefire. We also want you to be calling and emailing at the same time. So please utilize those tools on our website. There's also actions all week in DC as we lead up to November 4th, Saturday, which we're hoping will be the largest demonstration for Palestine in US history. I really hope that you all see this as a moment to not just check on your Palestinian friends, but to take action with your Palestinian friends as we call for a ceasefire and an end to all U.S. aid to the apartheid state of Israel. Thank you, Rashida, and thank you everyone for giving us this space.
Thank you, Ahmed. Next is my sister in this fight to save lives, is Beth Miller with Jewish Voice for Peace. Beth Miller has been on the front line and pushing and helping get not only members of Congress, but really communities of all different backgrounds and other faiths to really move in getting our country to support a ceasefire. With that, Beth Miller.
Thank you so much, Congresswoman, and thank you so much to everyone who shared over the last hour on this call. I think that one thing that feels very, very clear to all of us is that every single second and every single minute counts right now, and that we can't sit back and feel despair. For those of us in the US, we have to lean forward and we have to do everything we can to act now to change what our government is doing and to move and call for a ceasefire. This is clearly a matter of saving lives. And so I work with JVP Action and JVP. JVP Action is a multi-generational, multiracial movement of Jews and allies across the country that's working to shift and change our foreign policy around Palestinian rights so that we are actually focusing on human rights and justice for all. We have been doing, over the last few weeks in particular, a lot of work to try to bring the demand of a ceasefire now to our members of Congress and to the Biden administration. And I will say the one sliver of light that I see right now is that people are showing up. There are and have been happening. It's also really, really important that all of us take a moment and look around who is in our immediate circles and our immediate communities. Do you know people who aren't yet ready to agree that a ceasefire is the thing that needs to happen? Do you know people who are hesitant or afraid to call their member of Congress about this issue? Now is the time to have a conversation with them. Now is the time to lean into those things that might feel hard to do, but to reach out to the people who are closest to you and move them and bring them in, because we need every single person mobilizing around this urgently. So I think that if we all do that, if we really all mobilize together, if we really all reach out to everyone around us to get them to mobilize with us, that is the way we can collectively take action. That is the way we show power. And that is the way that we finally reach a ceasefire now.
Thank you so much, Beth. Thank you, everyone that has joined us. And it was thousands of people that were listening in. Thank you. Thank you for caring enough. And thank you for listening to the cries of mothers who said, what did my children deserve? Why? What did my children do to deserve this? And all of you are going to raise your voices and again, collectively move a mountain and get again our country to exit off of this war-free way and support ending the violence and supporting again the ceasefire. I want you all to know, I feel it. The majority of Americans are with us, of all different backgrounds. They see it, they understand what's happening, and they want it to stop. And I am also even incredibly hopeful as I see Israeli citizens rising up and also demanding a ceasefire. So we're not alone. More and more of us are speaking up courageously. And so from the bottom of my heart, on behalf of all of the co-hosts that are here, state reps, state commissioners and mayors, all of the folks that have already spoken up, thank you. Thank you for joining us tonight. Thank you for being part of a movement that will save lives. Good night.